Avoiding dates, key health problems and their side effects. While dates are often praised for their natural sweetness and nutritional benefits, they also pose potential health risks that are less widely discussed. Consuming dates in large quantities can lead to health complications due to their high fructose content, which can strain the liver and exacerbate health issues such as diabetes. Dates are notably high in sugar, which makes them a quick source of energy but also a risk factor for those monitoring their glucose intake. This high sugar content can lead to spikes in blood sugar levels, making dates a problematic choice for individuals with insulin resistance or diabetes. For diabetics, cautious consumption of dates is advisable. Despite their natural sugar composition, the glycemic index of dates is relatively high, which can cause undesirable blood sugar spikes. Diabetics should consider the portion and frequency of their date intake to prevent potential health complications. Dental health can also suffer from frequent date consumption. The sticky texture of dates causes them to cling to teeth, promoting the growth of bacteria in the mouth. This can accelerate tooth decay and lead to other dental issues, particularly if dental hygiene is not meticulously maintained. Moreover, the calorie density of dates is high, which can contribute to unwanted weight gain if they are eaten in excess. Their palatable sweetness often makes it easy to consume them in large quantities, which can add substantial caloric intake to an individual's diet, complicating weight management efforts. Allergic reactions to dates, though uncommon, can occur, especially in individuals who are sensitive to birch pollen. Symptoms might include itching in the mouth and throat, hives, and even respiratory issues. It's crucial for those with known allergies to be cautious and possibly consult an allergist. Dates contain a high amount of fructose, which can aggravate symptoms in individuals with irritable bowel syndrome, IBS. The fructose in dates can lead to abdominal pain, bloating, and altered bowel habits in sensitive individuals. Those with IBS might need to limit or avoid dates to manage symptoms effectively. Fructose intolerance is another concern tied to date consumption. This condition leads to difficulty in digesting fructose, resulting in gas, bloating, and diarrhea. Individuals diagnosed with fructose intolerance should consider avoiding dates to prevent these uncomfortable and potentially harmful digestive issues. The high sugar content in dates can also exacerbate acne and other skin issues. For individuals prone to skin problems, dates might trigger breakouts by increasing inflammation and insulin levels, thus promoting oil production in the skin. Moderation is key for those with acne-prone skin. Consuming dates might lead to yeast infections in susceptible individuals due to their high sugar content, which can fuel the growth of yeast such as Candida. Those with a history of yeast infections should be mindful of their date intake to avoid exacerbating this condition. People suffering from Candida, a yeast overgrowth, should be cautious about including dates in their diet. Dates are high in natural sugars, which can feed yeast cells and exacerbate the condition. For those managing Candida, it's important to monitor sugar intake from fruits and consider lower sugar alternatives. Dates can cause bloating and discomfort for some individuals. This is due to their high fiber and fructose content, which can be difficult for the body to digest. Those with sensitive digestive systems or conditions like irritable bowel syndrome might experience increased gas and bloating after consuming dates. Consuming dates might lead to constipation for some people, despite their high fiber content. This paradox occurs because dates also contain tannins, which have astringent properties that can reduce intestinal movements. It's vital to balance date intake with other fibrous foods and plenty of water to mitigate this effect. The relationship between dates and gastroesophageal reflux disease, GERD, is worth noting. Dates are acidic and can potentially trigger acid reflux in susceptible individuals. Those with GERD should be mindful of their date consumption and observe any potential exacerbation of symptoms after eating them. Individuals with Crohn's disease should approach date consumption with caution. The fibers in dates, while generally healthy, can aggravate symptoms during flare-ups by stimulating intestinal activity. It's recommended to consult with a healthcare provider to tailor dietary choices that align with one's specific condition. Dates are a nutritious fruit packed with fiber, vitamins, and minerals like potassium and magnesium. However, they are also rich in calories and sugars, which can be a double-edged sword. Overconsumption can overshadow their nutritional benefits, particularly for individuals monitoring their calorie intake. Pregnant women often consume dates to help with labor, but they should be cautious of the high sugar content, which can lead to gestational diabetes if not balanced with a healthy diet. It's essential to consult healthcare providers about appropriate portions to ensure both mother and baby remain healthy. The natural sugars in dates, primarily fructose, can cause rapid spikes in blood sugar levels. This is a significant concern for individuals with diabetes or those trying to manage their blood sugar levels. Consuming dates in moderation alongside foods high in protein or healthy fats can help mitigate these spikes. Dates are grown in conditions that might expose them to various pesticides, which can be harmful if ingested in large quantities. Choosing organic dates or thoroughly washing them before consumption can help reduce the risk of pesticide exposure and ensure safer consumption. Despite their health benefits, dates are calorically dense, primarily due to their sugar content. This can contribute to weight gain if consumed in large quantities, especially for individuals not balancing their intake with regular physical activity. Moderation is key to incorporating dates into a balanced diet without risking obesity. Dates are known for their sweet taste and nutrient richness, but they also significantly impact blood pressure. High in potassium, dates can help lower blood pressure levels. However, due to their natural sugars, excessive consumption can lead to weight gain, which indirectly contributes to hypertension, making moderation key. Elevated triglyceride levels are a concern for heart health, and dates might play a role due to their high fructose content. While they offer health benefits like fiber and nutrients, overindulgence can lead to higher triglyceride levels, which is a risk factor for heart disease, underscoring the importance of consuming them in moderation. Individuals with gallbladder issues should approach dates cautiously. Their rich fiber content can stimulate the digestive tract, possibly leading to discomfort in those with sensitive gallbladders. It's advisable to consult a healthcare provider to determine the appropriate intake level to avoid exacerbating gallbladder conditions. Dates contain moderate amounts of potassium, which is generally beneficial for kidney health by helping maintain fluid balance. However, for those with kidney disease, excessive potassium intake can be harmful. It's crucial for individuals with renal issues to monitor their consumption of potassium-rich foods like dates. Histamine intolerance can lead to adverse reactions when consuming certain foods, and dates might exacerbate this condition. They contain compounds that can trigger histamine release, which might result in symptoms like headaches, skin rashes, or digestive discomfort in sensitive individuals. It's advisable to monitor symptoms and dietary intake closely. The consumption of dates can potentially influence hormonal balance due to their natural sugars and fiber content. For some individuals, these components might exacerbate conditions like PCOS or thyroid imbalances by affecting insulin levels and hormone regulation. People with nut allergies often worry about cross-contamination in foods, and while dates themselves don't contain nuts, they are sometimes processed in facilities that handle nuts. This can pose a risk for those with severe allergies, making it crucial to check packaging for allergen information. Dates contain oxalates, which are naturally occurring molecules found in many foods. High levels of oxalates can contribute to the formation of kidney stones, particularly in individuals who are predisposed to the condition. Consuming dates in moderation is advisable if you have a history of kidney stones. Interactions between certain medications and the nutrients found in dates can occur. For instance, dates are high in vitamin K, which can affect blood-thinning medications like warfarin. It's important to discuss dietary intakes with a healthcare provider to avoid potential adverse effects. Thyroid health can be sensitive to various dietary components, including the selenium found in dates. While selenium is beneficial in moderate amounts, excessive intake can lead to thyroid dysfunction, underscoring the importance of balanced consumption, especially for those with thyroid conditions. Dates, often hailed for their nutritional benefits, can also impact cholesterol levels. While they contain beneficial fiber, which can aid in lowering bad LDL cholesterol, their high sugar content may offset these benefits if consumed in large quantities. It's essential to monitor intake, especially if you are at risk for heart disease. The safety of dates for children is a topic of interest for many parents. Due to their high fiber and sugar content, moderation is key. While dates offer vitamins and minerals beneficial for growth, their dense caloric nature could contribute to unhealthy weight gain if consumed in excess. Eating a large number of dates can lead to fiber overload, which may cause digestive discomfort such as bloating, gas, and abdominal pain. This is particularly true for individuals who are not used to high fiber diets. It's advisable to increase fiber intake gradually to allow the body to adjust. The glycemic index, GI, of dates is relatively high, which means they can cause rapid spikes in blood sugar levels. This can be a concern for people with diabetes or those trying to manage their blood sugar levels. Balancing date intake with lower GI foods can help mitigate this effect. Dates have been identified as a potential trigger for migraines in some individuals. This could be due to their tyramine content, a natural compound that has been linked to triggering headaches in sensitive individuals. Those prone to migraines may need to monitor their intake of dates to avoid exacerbations. Athletes often rely on natural sources of energy, and while dates are energy-dense, they should consider their high sugar content. Consuming large quantities can lead to quick spikes in blood sugar, potentially affecting performance negatively if the timing isn't managed properly during training or competitions. The cultivation of dates has significant environmental implications. Water-intensive farming practices are necessary for growing date palms, especially in arid regions where water scarcity is prevalent. This can lead to depletion of local water resources, urging a re-evaluation of agricultural methods to ensure sustainability. Identifying an allergic reaction to dates is crucial for immediate management. Symptoms can range from mild itching to severe anaphylaxis. Those who experience signs of an allergy should seek medical advice promptly to avoid more serious health complications. Incorporating dates into your diet can be beneficial due to their nutritional value, but it should be done cautiously. Balancing their intake with other low glycemic index foods can help mitigate the potential adverse effects of their high sugar content, especially for those monitoring blood sugar levels. While dates offer numerous health benefits, it's important to weigh these against the potential risks. For individuals with specific health conditions like diabetes or fructose intolerance, consultation with a healthcare provider is advised to tailor a diet that supports overall health without exacerbating symptoms.